Hello everyone, I am Dr. Tejashvi Bodicharla, consultant doctor in Fidicus Homeopathy. Today we are going to discuss a condition that can affect many women silently, that is urethral caruncle. In this video, we will mainly understand what is urethral caruncle, its symptoms, and its causes and risk factors. I can explain this clearly on the board. Let's move on to the board. Now let us understand what is urethral caruncle. Urethral caruncle means urethra is a place outside the urinary tract. It means it is a place where urine comes out from the body. In this urethral caruncle, there is a small swelling in the posterior wall of the urethra. It means external portion of the urinary tract. This small swelling we call it as urethral caruncle. In some women this swelling may be pinkish, or in some women it is of strawberry like color. Usually in females, the outer part of vagina and also urethra is lined with small mucous membrane. This mucous membrane is thin and lubricating in nature due to presence of estrogen. When there is deficiency of this estrogen, it can lead to dryness of the urethral opening and also dryness of the vagina condition. This dryness can cause the thinning of the urethral mucosa, and it can also disturb normal structure of the urethra, so that the inner lining of the urethra maybe comes out, and this can lead to cyst formation, that we call it as urethral caruncle. This urethral caruncle is mostly seen in postmenopausal women and also in women with less estrogen amounts. This is a non-cancer benign tumorous growth condition. This is mainly due to irritation and inflammation of the mucous membrane. So it is soft in nature and it can also bleed on touch. In some women, it can also cause burning pain. In spite of causing all these symptoms like burning pain, it is non-cancerous in nature. So this condition needs proper treatment and identification. Now let us come into the symptoms of urethral caruncle. These symptoms vary from one woman to another woman. In some women, these symptoms may be mild in nature, but in some women, it can cause severe complications and it can also disturb the daily activities like sitting, walking, and climbing. Now let us go through these symptoms one by one. The first most symptom is burning pain in the urethral region. Due to presence of these cyst-like swelling in the urethral opening, there is feeling of burning in the urethral region due to this irritation or inflammation of the mucous membrane, and also pain while passing urination. This pain may be felt during the act of urination, or in some women the pain may be felt at the beginning of the urination due to the contact of the urine with this mucous membrane. It can cause pain. This is the small visible growth in the urethral region. This small urethral growth may be pinkish or reddish in appearance. Some women may feel it as wart-like growth, but it is not a warty growth. Due to this small, flexible and delicate nature of this urethral caruncle, it can bleed untouched and it can result in spotting, and it can also cause difficulty in intercourse time due to this irritation inflammation in the urethral opening. In some women, there is feeling of pressure in the pelvic region due to the excessive growth of this urethral caruncle. Due to this growth, the woman may feeling of something is hanging inside the body or something going out from the body. It can cause pressure symptoms also. But in some women, it can cause difficulty in doing daily activities like regular sitting, walking, and it can also difficulty in climbing steps. So it can disturb the daily doing activities. Due to the inflammation or irritation in the urethra, it can disturb the normal urethral function, so that it can frequently attack with infection. It can lead to urinary tract infections. It can cause burning pain in urethral region, pain while passing urination, causing recurrent urinary tract infection, and it can also cause spotting or bleeding when we touch that urethral caruncle. These are the symptoms vary from one woman to another woman. These symptoms need proper identification, correct treatment. Now let us understand the causes and risk factors for this urethral caruncle. The first most cause of this urethral caruncle is estrogen deficiency. Usually, estrogen is the most important hormone in every woman. This estrogen balances the mucous membrane structure function. When there is imbalance in this estrogen after menopause or any surgical condition, it can lead to dryness of the mucosal membrane. This dryness can cause the irritation in the urethral opening. This irritation can cause development of the urethral caruncle, that we call it as cyst-like growth in the urethral opening. So, estrogen deficiency is the most important cause. Next cause is recurrent urinary tract infections. In this urinary tract infection, the exposure of urethral mucosa to the infection may be severe. Due to this recurrent infection, it can disturb the normal urethral mucosa. This can lead to urethral caruncle formation. Next, chronic irritation or friction. Due to wearing of tight garments or tight undergarments, it can cause the irritation in the urethral region due to rubbing of the cloth with the urethral mucosa. This constant rubbing can also cause the development of the urethral cyst. Next is atrophic vaginitis. Atrophic vaginitis is one of the cause of this urethral caruncle. In this atrophic vaginitis, there is development of dryness in the vagina condition. This dryness in the vagina and also urethral opening can cause the development of the urethral caruncle. This atrophic vaginitis mainly seen in the postmenopausal women. Next is trauma. Trauma usually happen in childbirth times and using and also rough rubbing and also using hard soaps and chemicals. These trauma conditions can also damage the urethral mucosa, though it can lead to development of the urethral caruncle. Next is pelvic floor muscles. When there is weakness in the pelvic floor muscles, it can disturb the normal function so that inner tissues may fallen outward. These tissues can lead to form a structure called urethral caruncle. Next is constant straining during constipation. When there is constipation, due to constant straining, mucous structure may be disturbed. These disturbed mucosa can lead to formation of cyst-like swelling called urethral caruncle. This is mostly seen in women after 40 years. Apart from this, some risk factors like hysterectomy patients who are having hysterectomy, who removed their uterine cavity, and also who are went for surgery like removing of the ovaries condition. In all these conditions, the levels of estrogen may be fallen down. This estrogen falling down can lead to development of the urethral caruncle. Maintaining poor genital hygiene, wiping the genital area with hard soaps with and also rough wiping can also lead to this development of urethral caruncle condition. Next is diabetes mellitus, one of the cause for this development of urethral caruncle. In diabetic conditions, there is more chance of getting infection. It can increase the infection chances. So, in these diabetic patients, infections are more and it can also lead and recurrent infections can lead to the formation of urethral caruncle. Postmenopausal women, pregnant women, and also women who went for surgeries, and also in diabetic women, this formation of urethral caruncle will be severe problem. If you are struggling with these urethral caruncle symptoms, contact Fidicus Homeopathy. If you notice any of the symptoms of this urethral caruncle, Fidicus Homeopathy is the best option. What do you get from Fidicus Homeopathy means the success of case mainly depends upon the three main steps. One is the treating doctor, second one is the drug device we are following, third one is the infrastructure we have. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence and compassion. The drug devices we are following is of top quality medicines and we are also best in segment. We are getting our medicines from best pharmaceutical industries and we are also best in segment. The infrastructure we have is of latest technology and also artificial intelligence. By using this latest technology and artificial intelligence and treatment option, we can give better results to the patient. Now coming to the consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation, second one is in-person consultation. In online consultation, audio and video call options are available. By using this option, you can share your report. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. After completing the case, taking the main treatment will be started. Once the treatment is started, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. If you want to consult Fidicus Homeopathy by in person, you can visit our nearest